Welcome, Joslyn Center Facebook Live fans. This is Jack Newby. I'm Executive Director of the Joslyn Center. We'll be doing our interview in just a few moments, but before we do that, I did want to go over a few things. This is Meals on Wheels month, and so the Joslyn Center does provide Meals on Wheels to people in our surrounding communities. So that's the Del Webb communities, Palm Desert, Rancho Mirage, Indian Wells, and other communities in the unincorporated area of Riverside County. So we wanted to let you know about that service. And if you are interested, you can look on our website and fill out the application, or you can call the Joslyn Center at 760-340-3220, extension 110. That's Bob Elias, who manages our Meals on Wheels program. The other thing we have coming up is our Joslyn and Bloom fundraising event. So that is also on our website at joslyncenter.org. And that's coming up next month on the 13th. And it's a great fashion show. It's produced by Susan Stein, who also produces Fashion Week El Paseo. And we use as our models, no professional models, they're people from the community that you may know. So it's going to be a great luncheon, silent auction, the fashion show. And so it's a great opportunity and fun opportunity to support the Joslyn Center. So if you want to find out more information about that, you can contact Greg Murphy, who is our Director of Development. And he's at 760-340-3220, extension 107. And if you want to be a sponsor of that event, he'd really be happy to talk to you. So that's what's happening here at the Joslyn Center over the next few weeks. Also, I want to remind you about our Wellness Center, that if you are having problems with anxiety or depression and want to talk to someone about that, we have a free counseling service at our Wellness Center. We're happy to speak to you and arrange an appointment, and that would be contacting Alex, again, at that same number, 760-340-3220, and talk with Alex, and he's at extension 117. So we're very fortunate to have with us today Dr. Saguil, who is from Family Hospice, and we're going to talk a little bit about hospice, and that's an important subject. So welcome, Dr. Saguil. How are you this morning?
I'm fine, Jack. Thanks so much for inviting me.
Well, thank you for coming to talk to us. You know, a lot of people, I think, don't understand what hospice is and maybe be a little afraid of what it might mean. So tell us, what is hospice and what are some of the fears that people have about it that really they shouldn't be afraid of?
Well, first of all, thanks everybody for having me today. It's a pleasure to be with you. Well, to answer Mr. Newby's question, hospice is a team approach to address the needs of patients and caregivers for people who have terminal illnesses not expected to live 6 months. What it's about is to live your best life in whatever time is left. Because when time is short, we try to make sure that it's the best possible that it could be. There are misconceptions about it, particularly, I think, with the fear that people are just going to be put in a room, close the door, start morphine. That's actually not how we approach it. We encourage people to live their best life, however they can do that. If they need to go shopping and buy a fabulous outfit for the day, that's what we want them to do. If they don't feel like doing that and just want to rest and be in bed and with comfort, that's what we do too. And it's all focused really to the patient and their caregivers. As patients go through what I call the journey to their final moments, we are there as a team, the doctor, the nurse practitioner, the nurse case manager, the social worker, the spiritual counselor, the volunteers, and home health aides, to make sure that that journey is the best possible.
So it sounds like there is quite a team involved in helping the family and the patient through those final months of life. I didn't ask you at the beginning, what do you do with family hospice?
Oh, well, I'm the medical director and I'm the attending physician. I'm trained as an internal medicine physician. I'm board certified and a fellow of the American College of Physicians. And I've been practicing for 40 years, taking care of very complex patients. And what I've learned is that as patients have these chronic illnesses, it's very, very important to understand what their goals are in whatever timeline they have left, whether it's 50 years, whether it's 40 years, whether it's 30 years, whether it's 6 months. So I like communicating with patients to make sure that we understand what their goals are. Now, this is important in hospice because as time is short, it's so very important to understand from patients what's important to them, what are their fears and worries, what are their sources of strength, what are their critical life abilities that are so important to them they can't imagine living without them, and how much are they willing to go through. This is important because we designed the program, particularly in hospice, around the patient's needs. Rather than trying to figure out how to cure, we refocus and figure out how we can care for them better.
So that's, one thing that I've been, and it's, I hear people talking and some observations that I've seen for family members and people that I know, that a lot of times, although it's for people that are 6 months, projected 6 month lifespan, that people are going into hospice later and later. They're almost, waiting to the last weeks or so. Is that your experience as well?
It's the experience of all hospices throughout the country. And I think there's a couple of reasons for that. Now, whether it's, 6 months or 6 days or 6 hours, hospice can still help with people with terminal illnesses. It's best in the 6 month mark because it allows everyone time to get symptoms under control, time to relieve stress and anxiety, and most importantly, time to say goodbye. And with this hospice approach, which is the team approach going to the patient's home or wherever the patient is, we afford the patient and the family that opportunity to have the best time available to relieve the stress. Now, this stress is also to the caregivers themselves because they're the ones taking care of patients, and it helps them during that period of time. Now, it's, as you said, it's obvious when people are in their last few weeks of life. It's not so obvious when they're at the 6 month mark. That's what my expertise is. To your specific question, most of my patients that we have on Family Hospice Care are within the last 6 to 8 weeks of life, so about 2 months. And while we're taking very good care of them, we are trying to make sure that things are in place in a more rapid fashion. But if we had the 6 month mark, that could be an easier transition. There are a bunch of reasons why, as I said, we tend not to start at the 6 month mark. It is the recognition. It's difficult to recognize when people are at the 6 months, and that's what I do. That's my expertise. And I also think this is an important point. The discussion with your physician tends to emphasize when things are in transition or too late. It's not at that 6 month mark or when things are predicted to have a poor outcome. That's also another expertise I have, is to try to prognose or predict when these events take a terminal trajectory. So
we've been talking a lot about the patient and the services that are provided to the patient, but hospice is also important for, as you mentioned, the caregiver, or in many times it's the family that's taking care. What sort of services or education are provided to the family and caregivers?
Well, during a patient's disease process, it's so important to involve families and caregivers because, as I said, it's the patient going through the journey, but it's also those caregivers and families who are going through it with them as well, with all the stress, all the anxiety, all the burnout that occurs. So with hospice, the benefit for the caregivers is that we can relieve some of that anxiety through the explanation of what's going to be happening, through the access when things happen suddenly in the middle of the night. You have got somebody to talk to, and to help teach the families how to caregive, when to feed patients, when not to feed patients, when to turn patients, when to leave them alone. We can also help by giving, one of the benefits of hospice is something called respite. So when, as we all know, everyone needs a time off from stress and anxiety, we can take patients, if they're in the home environment, and use the respite benefit by putting them temporarily in a nursing facility where they can get everyone can get a little time off, and then have them come back to relieve some of that pressure and some of that stress. Some of the other things which are important with hospice benefit is that there are volunteers. That's so important too. People who from the community who volunteer with us to be people, just normal people, just to have socialization or read books to them, or even pets. We have pets who come into the family's home just as a way to have another avenue to relieve stress. And we also have people who, this is a new thing that we're doing in family hospice care. They're called doulas, and that's an interesting word, but what it means is that there are people who can talk to people and sort of write down their life story for them so that they have a way to express themselves, so that it becomes about how they lived rather than how they are dying. So a lot of different benefits as well. And spiritual counselors, I have to mention that as well. This is a spiritual journey for many, many people, and you don't have to be spiritual, but for those people who have spirituality, we also have spiritual counselors who can also guide and connect them to whatever faith-based organization they belong to, or you don't have to either.
Well, I can say from experience, when my mom passed away, she was on hospice for several months, and the education that's provided to the family about the process and what to expect, so what's happening in that process. It was really helpful and comforting to know, because otherwise, if you didn't know, you may panic or be upset about something that's happening. When it's actually part of the process of a person dying. So, and one thing we didn't cover, go ahead.
Oh, I was going to say, there is a process of bereavement as well after the death occurs, because, life goes on for people who survive their families, but it's difficult for them also, trying to process the grief of it. And I wanted to mention also, part of the benefit is something we call bereavement counseling. After the death period, people who are available to the families and caregivers in a group setting or in a one-on-one setting, where you can talk and process about really such a life-altering occurrence that has happened. We also have pre-bereavement, by the way, so it's even before bereavement starts, before the death starts or has occurred, that you can, as you have done very admirably, to start talking about it through the process so that closure happens in a much more controlled way.
Well, that's very important. That bereavement process, or even the pre-bereavement, so people can, especially in a group setting where they can talk and share experiences and see that their experiences may be similar to others, and that can really bring about some comfort, and to be able to do that in that type of setting. One thing that we didn't quite cover is that hospice is not really medical care in terms of trying to cure the disease or illness. That's not hospice.
That's correct. But what I like to tell people is that it's not about giving up or taking away. It's recognizing that the outcome is going to be what the outcome is going to be. Usually, treatment won't help. So yes, you can treat it, but the outcome is still what it's prognosed to be. Now, instead of trying to cure, though, what we refocus is to try to care for the patient. So I try to emphasize that because I think a lot of people think, oh, you're just giving up, I have no more hope. It's that we refocus the hope. The hope is to have the best quality of life possible in whatever time is left. And when you think about it that way, you see the real benefit of how hospice can be. We don't stop, however, we don't stop medications for your blood pressure. We don't stop medications for your diabetes. We don't stop medications to treat infections. We can do all that, but we don't focus on the cure of something which is incurable, is determined to be incurable.
So I think that's an important distinction, in knowing that the other medications that a person needs are being provided. So if someone wanted to get in touch with Family Hospice or find out more about hospice care for a loved one, how would they do that?
Well, we're very proud to have a relationship with Joslyn Center. I've actually been out there as well to talk about life planning and secrets to stay healthy. But the simple telephone number to call is 760-674-3344. Family Hospice Care has been around since 2006. And I think we distinguish ourselves through our efforts through clinical excellence. As I said, I've been in practice for 40 years. I have a breadth of internal medicine, and I personally review the charts to make sure that care will continue in a very coordinated and seamless pattern. So should anyone find themselves in this situation, we're more than happy to talk to you. And of course, we're more than happy to take care of you.
Well, Dr. Saguil, I want to thank you very much for your expertise and letting us know more about hospice care and the importance of it, both to the patient and to the family and caregivers. We really appreciate you taking the time, and want to thank you and wish you a good weekend.
Well, thanks very much. And thanks for having me here as well.
Okay. And thank you to all our viewers, and we will be with you next week. Have a great weekend. Bye-bye.